Is a stereotactic brain biopsy safe? When considering a stereotactic brain biopsy, many people wonder about its safety. This procedure is generally regarded as safe and effective for diagnosing brain lesions, including tumors. It is a minimally invasive technique that uses advanced imaging to precisely obtain tissue samples from hard-to-reach areas within the brain. This precision helps to minimize damage to healthy tissue surrounding the biopsy site. The mortality rates associated with stereotactic brain biopsy are low, typically ranging from about 0.6% to 3.7%. Many studies report rates around 1% to 1.5%. This indicates that serious complications are quite rare. Morbidity rates, which refer to complications that may lead to new neurological deficits or other significant issues, are also low. These rates are often reported between 1.2% and 7.4%, with symptomatic complications occurring in about 2% of patients. One of the most common complications is intracranial hemorrhage, or bleeding within the brain. This occurs in approximately 1.7% to 4.7% of cases. However, only a small portion of these hemorrhages are symptomatic or clinically significant. Other potential complications can include transient neurological symptoms, which may resolve on their own or with medication. Stereotactic biopsies are often performed in areas of the brain that are less critical for function, which helps to reduce risks. Recent advances in technology have improved safety even in deeper or more eloquent brain regions, which are responsible for important functions. New methods, such as optical imaging and real-time vessel detection during the biopsy, are being developed to further lower risks by avoiding blood vessels and ensuring accurate tissue sampling. Both frame-based and frameless stereotactic biopsy techniques have comparable safety profiles. The primary goal of this procedure is to safely obtain representative tissue for histological and molecular diagnosis. This is crucial for planning appropriate treatment for brain cancer or other brain diseases. Despite the risks involved, the benefits of obtaining a definitive diagnosis generally outweigh the relatively low risk of complications, especially when the procedure is performed by experienced neurosurgical teams. In summary, while a stereotactic brain biopsy does carry a low but non-zero risk of complications, advances in imaging and biopsy techniques continue to enhance its safety profile. It is important for patients to discuss their individual risks and benefits with their healthcare providers, as personal factors can influence the overall safety of the procedure.